All right, before we jump in, just a quick but really important heads up. Everything we're about to cover is for your information and education only. It is absolutely not medical advice, so please, for any health concerns you have, make sure you talk to a licensed medical professional. Okay, let's get right into it. Today, we're taking a deep dive into the world of modern lumbar spine surgery. And we're going to focus on the two big ideas at the heart of it all: motion and stability. If you or someone you know is dealing with back pain, this is all about giving you some clarity on the whole journey, from that first diagnosis to making a huge decision. So, where do we even begin? Well, we're going to start with maybe the most critical piece of this entire puzzle: the diagnosis itself. Because honestly, the label you might have been given is one of the most misunderstood things in all of medicine. So I want you to think about this for a second. What if that scary-sounding term you might have heard, degenerative disc disease, is just wrong? What if it's not a disease at all? This is a huge mindset shift, and we need to make it right from the get-go. Okay, look at this number: 64%. Just let that sit there for a second. Right now, it might seem random, but trust me, this number is the key to busting a massive myth about back pain. So what is that 64%? Well, get this. That's the percentage of people with zero, absolutely no back pain who still have things like disc degeneration or bulges show up on their MRI. So what does that tell you? It tells you that what a radiologist sees on your scan isn't always the villain. A lot of the time, it's just a normal sign of your spine adapting as you get older. And I love this quote from Dr. Jacob Creeman because it just nails it. Think about it. We get gray hair. We don't call it degenerative scalp disease. So why on earth do we use such a scary word for our spines? The word disease creates fear, and that fear can make you stop moving, which is often the worst thing you can do. Your spine isn't failing, it's adapting. Okay, so if what we see on an MRI isn't necessarily a disease, then when does surgery even get on the table? This brings us to a really important idea called the surgical threshold. Now, this is super important to understand. Surgery is almost never the first move. In fact, for most elective procedures, there's this mandatory 6-month gatekeeper period. You have to go through a full-on conservative care program. We're talking movement, diet, sleep, and your mindset. You really have to give those a fair shot first. So let's be clear, surgery really comes in two flavors. You've got the super rare, real emergencies, like something called cauda equina syndrome, where you need surgery fast to prevent permanent damage. But the vast, vast majority, like over 90% of spine surgeries, are elective. They are not about preventing a disaster. They are 100% about one thing: your quality of life. And honestly, this golf analogy from Dr. Brian Sue is the perfect way to think about it. If you tell your doctor, hey, my back only hurts when I golf, their first response might be, okay, so stop golfing, right? But what if golf is your whole world? It's your friends, your passion, your escape. Then suddenly it's a completely different conversation. The goal of surgery isn't just about changing a pain score. It's about getting you back on the golf course. It's a deeply personal decision based on what makes your life worth living. All right, so you've crossed that threshold. You've tried conservative care, it didn't work, and your quality of life is just not there. Now you're at the big fork in the road, facing the central question in all of modern spine surgery. And it really boils down to two totally different philosophies. Do you eliminate the motion at that painful spot to create rigid stability? That's a fusion. Or do you try to preserve the motion to keep things moving as naturally as possible? That's a replacement. This is the core debate. So let's break that down. A fusion basically locks a segment of your spine. And while that can work, it means all the stress and force now gets transferred to the discs right above and below it. And over time, that can wear them out, a problem called adjacent segment disease. A total disc arthroplasty, or TDA, was designed specifically to solve that problem. By preserving motion, it helps spread the load out more naturally, protecting its neighbors from all that extra stress. And just look at the technology itself. It's pretty amazing, right? You've got two metal end plates made of cobalt chromium that anchor right to the bone, and they have this cool porous coating so your bone actually grows into them. In between, you have a core made of a special medical-grade plastic that allows for movement. The whole idea is to mimic a healthy disc's mechanics as closely as possible. This whole new way of thinking, preserving motion, has completely changed not just the surgery, but what life looks like after surgery. So it's time to bust some of those old fears. I mean, this slide says it all. The old, scary stigma around back surgery comes from a completely different era. We're talking the 1970s, when you could end up in a full-body cast. Today, we're talking a small incision, and patients are literally up and walking around within hours. It is a completely different world. It's not your grandma's spine surgery, not even close. So what does recovery actually look like? Well, it's a pretty clear roadmap. You're walking on day 0. Within a couple of weeks, a lot of people are driving and back at a desk job. Then, around week 6, you start that important physical therapy to retrain your core muscles. And then, by month 3, once the implant has fully bonded with your bone, you're often getting cleared to return to sports. The whole focus is on a smart, progressive return to a full life. Okay, get ready for what might be the most surprising number in this entire explainer. Less than 1%. What could that possibly be? This is incredible. According to long-term research from pioneers like Dr. Rick Gyuri, if you follow patients for 2 decades, less than 1% of these lumbar disc replacements needed a second surgery. Think about that. That's a durability rate that's actually better than many hip and knee replacements. So that old fear of what if it wears out? Well, the evidence just doesn't support it. These things are built to last. Whew, okay. We have covered a lot of ground, from your mindset all the way to the mechanics of these implants. So let's wrap this up by putting the power back in your hands, giving you the tools you need to advocate for yourself. Now, this isn't about going to Dr. Google. This is about having a smart, productive conversation with your surgeon. So take a screenshot of this, write these down, ask them what recovery will look like for your life, ask about the real risks, and definitely ask them how many of this exact procedure they perform. Experience matters a lot. And that really brings us to the most important point of all, from Dr. Good. At the end of the day, you have to take ownership. It's your body, your life. Your job is to get all the information, understand all your options, and then make the decision that's going to let you live your best life. I really hope this breakdown gave you a much clearer picture of what modern lumbar surgery is all about, because knowledge is the best antidote to fear. I'd love to hear from you in the comments. What was the one thing about the recovery roadmap that really surprised you? Thanks for being here.